The intersection between sexual health and menopause is complex. We're fortunate to have with us today Dr. Kathryn Macaulay, clinical professor of obstetrics, gynecology, and reproductive sciences here at UC San Diego Health, and the director of the Menopause program. Dr. Macaulay, thanks so much for being here with us. What are some changes that a patient can expect for sexual health during the menopause transition?
So common complaints, first one is vaginal dryness. We do see changes based or due to the decline of estrogen over time and over the perimenopause and with menopause. The decline in estrogen causes thinning of the vaginal walls, reduced lubrication, so women can experience vaginal dryness. Sometimes they only notice the vaginal dryness when they're having sexual intercourse and they're feeling pain with intercourse. They need to use a lubricant. This can affect libido if sex becomes uncomfortable. Libido itself, though, can happen independently of discomfort with intercourse, and that's another common complaint women have with sexual function during menopause.
So in terms of the symptoms that women could consider to seek treatment for, what I'm hearing is pain with intercourse. Mm-hmm. What are some of the options that they might have?
So fortunately, vaginal estrogen is really quite safe to use. So we have a variety of different vaginal estrogen products, including tablet suppositories that come with applicators, inserts that one inserts with their finger, vaginal creams, vaginal ring that releases estrogen continuously. So vaginal estrogen is our sort of mainstay. Mm-hmm. But also we have DHEA, an adrenal hormone that's converted to estrogen and testosterone in the tissues. Mm-hmm. So that's a vaginal insert that women use daily. The other inserts for estradiol, they just use twice weekly. Mm-hmm. So less options. So different dosing options and different formulations that we can offer women depending on their preferences, their insurance coverage and such.
Gotcha. When might somebody use DHEA as opposed to vaginal estrogen?
The vaginal DHEA is FDA approved for painful intercourse. We call it dyspareunia after menopause. So they could use that as a first-line treatment if desired. They could try the estrogen first and try the DHEA next if it didn't work. But they can use them all therapeutically. They all seem to be equivalent. There's not a lot of head-to-head data comparing them to each other, but we do have good data that they're all effective.
What's your viewpoint on vaginal moisturizers?
So vaginal moisturizers are also a good first-line treatment. There's a variety out there. It's a big market, so women have to sometimes get guidance from their healthcare provider, kind of what to try. Mm-hmm. But one popular one right now is hyaluronic acid. That seems to be a popular product that has the variety of nice formulations that are available over the counter. It helps to draw moisture into the vaginal tissue, which can be useful.
Great. I heard you mention hypoactive sexual desire. What are some of the options for a patient that might be experiencing that? And what is that?
Yeah, so hypoactive sexual desire disorder is more commonly referred to by patients as, or by providers too, as low libido or low sexual desire that's causing distress. So it's really an absence or a significant decrease in sexual thoughts, interest in sexual activity, and women can be really quite bothered by this change. So first, I'll address pain with intercourse because, of course, if intercourse doesn't feel good, there's going to be a low drive or desire to engage in the activity. But if that's not the case, then we'll look at just the desire component. So it's multifactorial. It can be related to other life stressors, relationship with partner, other medical comorbidities or health problems the patient may have. But maybe not have any of those other issues affecting the woman. It may just be a change that just came with menopause. So in those cases, I'll talk to women about the option of using off-label testosterone. It's not FDA approved for women, but we sometimes will use testosterone formulations that are available for men in a much, much lower dose and monitor their testosterone levels carefully. So that can be offered, as well as another treatment is bupropion, which is a medication commonly used for depression and anxiety, but is a dopamine norepinephrine reuptake inhibitor that we have a limited amount of data, but some data supporting its efficacy for increasing libido. So we do have some treatment options. Also sex therapy. I think it's underutilized, but we have a good variety of therapists and even a society that trains therapists in sexual medicine and therapy, that women can go to that website and find a provider that does sex therapy.
That's great. It's so nice to know that there are options, and it's something very important to get to talk with your provider about. So thank you so much.
Sure.